A lot of you I know have aches, pains, pulls, all of us. Larry, you have a lot. He's going to talk to us about, what they are, how to deal with it, how to help, and he's going to tell you basically what that wants to do. Here we go. Thanks.
Thanks so much for having me, guys. What you're doing here is really inspiring. I'm honored to be a part of it this morning, and so I just want to start by thanking you for having me, and also thanking RunTex and Paul for setting up this program. It's great to see Austin businesses who are really working to help the community in a big way, so it's great to be here. So more specifically, we're going to look at injury prevention, and if I were to try and cover every weakness or tightness that may end up causing some issue with a running or walking program, we'd be here all day. So I'm going to focus it down to some specific weaknesses in the hip area that I see very, very commonly with knee, hip, and back injuries in the patients that come in for those issues. Right? So just to give a quick overview of what we're going to do, we're going to look at those specific muscles, what they do, how their weaknesses might lead to some sort of injury, and then how you yourself can actually test to see if you have some weaknesses in those areas, and then finally a couple things you can do to work on strengthening them before it becomes a problem. So the muscles we're looking at are the hip abductors, it's a kind of a funny name, and the rotators, and more specifically the external rotators. And so what do those do? First of all, hip abduction is moving your leg out like this, and external rotation is moving like this. So why would it be important to be strong in that way or this way? It actually isn't very important to be strong doing that. It's important to be strong with what those muscles do when your foot's planted on the ground, which of course happens with every single step we take, especially when you're running. It drastically increases the forces through your hip, through your knee, and your back. So what the abductors do is, as you lift up to take that step, or when you're jogging, it keeps your hips level. If they're not doing their job, your hips are either going to go out like this to the side, or some people will do a big trunk lean to counterbalance. So those are the two main compensations that occur. The external rotators are also involved in that situation of keeping your hips level, but they're especially important for if you're doing any kind of bend to the knee, especially like going downstairs or when you're running, you're always going to hit with a big knee. It keeps the knee over the toe where it should be rather than turning in like that. Okay? So what would the problem of walking around like a salsa dancer be? The problem is, let's start with the back. If you're dropping your hip out with each step, or when you're running, the opposite side of the back, those muscles are going to be working harder than anything to try and elevate that hip to keep you stable. So you end up overusing the muscles on the opposite side of the low back, and they're getting yanked on with every step you take. So I've had plenty of patients who have one-sided low back pain, and maybe not the whole equation, but a big part of it was simply a weakness or dysfunction of the opposite hip muscles. So then if you look at the hip directly, every time you go out like this, you can imagine it kind of puts a strain of the tissues over the hip. There's also a bursa in there. A bursa is a fluid-filled sac. And if you're constantly compressing that over time, it's going to get irritated. Has anyone in here had any bursitis before? They're stubborn, they're hard to deal with, and you don't want to go there. That strain doesn't stop at the hip though. It goes down what's called the IT band. She's got a foam roller. I'm sure she knows what the IT band is. So that attaches at the outside of the knee. And again, if you're constantly pulling through these tissues, you can get IT band syndrome or some kind of tendonitis on the knee. And then looking at the knee joint itself, when you have this, when the rotators aren't doing their job, and the knee's dropping in every time you do a squat or every time you're running, that rotational component is going to shear. It's going to do a shear force of the cartilage in your knee. So you're going to get cartilage breakdown, ligaments are going to get strained or torn, all kinds of things. So the list actually goes on from there. But you can see that just a few little muscles in the hip, if they're not working, it can be a cascade of problems. Okay? So how do you know if you have problems here? It's pretty simple, but I just want to say up front, if you're going to try what's listed on there at home, what I'm about to show you, be really cautious. Don't just expect that you have good balance or that when you do a one-legged, mini squat that your knee's going to hold up, make sure you have something to hold on to that, you can put your other leg down real quick if it doesn't go the way you expect it to, okay? So really, no one get hurt doing these things at home, okay? So the first one is just a single leg balance test. You're just lifting the leg and seeing what happens at the level of the hips. Do you drop out like I just described, or do you have to lean to the side to hold your balance? If either of those happen, then you definitely have some hip abductor weakness that you want to work on. If you have an issue with that, you probably don't even need to do the next one, because it's very rare that you're going to be weak in the abductors but strong in the external rotators. So you can just go straight to the exercises from that point. But if you want to do that, basically, unlike the headless guy on your handout there, he's got his leg behind you. I like to do this test with the leg in front. It's a little more like stepping down stairs. And you're just going to do a little mini squat and see what your knee does. Does it turn in? You go on the inside of your foot, this, or does it stay straight over the toes? Okay. So if you have either of those problems, you know it's something that could lead to all those issues I just talked about. And there's some pretty simple things that you can do on your own to help prevent it becoming an injury. So the first on your list there, I talk about a core muscle contraction. The way I define the core actually includes all the hip muscles. Depends on who you ask. But it's really important that you link the core to your hip muscles. If you can create a stable core, stable base from which your arms and legs move, everything that moves off that base is going to move more efficiently. It's like if you were on a platform in the water and you try to push off and it gives, you can't get as much of a push off, right? So first of all, this belly button to spine contraction in your handout, it's not a tight contraction of your abdominals. It's not a breathing in real deep and just sucking in and puffing up your chest. Everything stays fairly relaxed. You're simply trying to bring your midsection back towards your spine, okay? And so your first bit of homework with that would be just work on doing that. You don't have to take time out of your day to do it. You can do it at work. You can do it when you're doing your walking training, and you should. But work on doing that while breathing normally, trying to keep from holding your breath while you're doing it. Once you're able to do that, you can combine that small contraction with lifting, with turning, with running, with whatever you're doing. It's going to make your back a lot safer as well. It's going to make your hip muscles fire better. Okay? So now onto those two exercises. One is make sure you have something to hold on to. Just you're not holding, really tightly, but maybe fingertip balance. And you're just going to go belly button to spine, lift the leg, and if you can do it in front of a mirror for a while until you know you're doing it with good form, that's best. Because you want to make sure that you're not letting the hip drop as you do it, right? Or you're not leaning over it, right? So those are the two things you look for. And in the beginning, you might have so much weakness there that you have to lean, and that's okay. But over time, it will get better and try to get the shoulders more over the hips and keep the hip from dropping too much. The next one is a clam. Has anyone done clams here before? Yeah, a few hands. So I'm not going to lay on the floor and show you, but there's a little demonstration on my feet there. Dirty or something? These are nice lean shoes. But anyhow, the thing to look out for there is that when people do clams, Sam on my side, they often will drop their hip back. You're just trying to lift your knee up and keeping the hip forward. So I wrote that on there. Keep your hip forward, and again, belly button to spine throughout the time that you're doing those. And in terms of reps and sets, let your body be the guide. When you start to feel a decent fatigue when you're doing the standing or when you're doing the clams, then you stop that rep or stop that set. So maybe you do 3 or 4 rounds of each on both sides, right? Until you feel a fatigue set in, and then you can go on about your day. Maybe do some more later that day. But if you were to do these every day or every other day, over time you're really going to start to feel a difference in the way your hips and core function as you're moving. You're going to be able to avoid all those injuries. And, it's not a guarantee, but you're going to be a lot less susceptible to those injuries that we talked about in the beginning. So I want to say one more thing before we go into question and answer. If you go home and you find that you do have these weaknesses, it doesn't mean to freak out and worry that by doing this program or by doing any exercise, you're at risk for injury. That's not the case. What it means is think about incorporating the belly button to spine and the trying not to shift, the trying not to drop your hips as you're walking and as you're running. If you focus on those things, you're going to be a lot more effective and less susceptible to injury. But don't worry if you find these injuries. It just means it's something going to work on. It's not that you're going to go out and hurt your knee the next run.